Hi, I'm Dr. Clara Scott with My Family Vet, and I want to cover a major important topic today called heartworms. Heartworms are an epidemic here in Texas, partly because of how much water we have in this North Houston area. And so heartworms are easily transmitted by mosquito. And the number one source for heartworms, and the ultimate source, is the dog. So heartworms show up in all kinds of mammals, but they set up house in the dog. In the cats, even one heartworm can be fatal. So we don't rarely and routinely test cats for heartworm because if we do get a positive, there's not a whole bunch we can do for those cats. But when we do get positives in the dog, what does that truly mean? So what I want to cover today is life cycle and what we can do as veterinarians and pet owners to protect our patients. The date today is April 2015, so if we need to update this video with newer technology and newer information, we can. But what I want to do is start with life cycle. So worms are worms. They are a parasite. On day 0, they're just babies. Where are these babies coming from? These babies are coming from a supersized Texas mosquito biting the dog that has jumped from a positive dog to our dog, and they're also coming from adult worms that may already be there. So there's two sources for baby worms, either those coming from the mosquito or those coming from the adult worm. Those babies mature over time, roughly 30 to 45 days, and they mature in the right side of the heart. And there are thousands upon thousands upon thousands. Some die off along the way, some are killed with heartworm preventative, but ultimately those that make it to the heart are protected by this heart muscle. And we have a 4-chambered heart, just like the dog. And those worms are protected in there. Now, once those worms start to die, the next place they're going to go is the lung tissue. So that's why this is so dangerous. It's not like I give a dewormer and the dog poops out all the worms. These worms are in the bloodstream. And where does blood go? Everywhere. Blood goes to the lungs, the kidney, the liver, the spleen, you name it. That's what keeps us alive. They can even end up in the eye. So truly, heartworms are incredibly dangerous. In the microfilarial stages, they can hit just about anywhere. But as they mature, that's when they really cause their damage. So what the heartworm preventative is doing, your basic heartworms like Iverheart, HeartGuard, those dewormers are killing these baby worms in various microfilarial stages, so you never get development into the heart tissue. So we're killing all the babies at this point in time, whether they're coming from the mosquito or they're coming from worms already in the lung tissue. And so we're stopping the cycle so that we still don't get more and more. And so number one thing that we do if a dog comes in heartworm positive is we can heartworm treat with heartworm preventative alone. And what that preventative is going to do is stop the cycle and not let any more mature. The other thing that heartworm, so the number one thing it's going to do is stop the cycle. The next thing it's going to do is it's going to weaken the adult. Okay? So we are weakening the adult worm as well as stopping the cycle. But if one worm dies this month, it's going to go into the lung tissue. Hence, that's why we see coughing. So one of the number one signs of heartworm disease is coughing. And that dog will cough and cough and cough no matter if they're on antibiotics or not. So heartworm preventative alone, it will take between 1 and 1.5 years to be heartworm negative. So if I have a positive dog and I put him on heartworm preventative, it'll take that long for them to be negative. The second thing we can do is heartworm preventative, and then we add in doxycycline and pred. What do these two drugs do? Doxycycline is an antibiotic, and prednisone is a cortisone. And what those drugs do, the doxycycline also weakens the adult worm. So I'm weakening the adult worm using the heartworm preventative, and I'm weakening the adult worm using that antibiotic because there's a certain bacteria that lives on the worm that's susceptible to doxycycline. So if I kill that bacteria, then I kill that worm. So what the prednisone is doing is once those worms leave the heart, they can cause inflammation in this lung tissue. So the prednisone is helping reduce inflammation as well as helping the dog with the cough because there's also inflammation in that lung tissue. The third thing we can do here at My Family Vet is going to be the full face treatment. And these treatments increase in price because we're using more product, it's taking more time, it's using more injections. And the full face is one of the least liked treatment plans in our clinic because I'm trying to kill all these adult worms at one time. And if you think about all those worms and the blood vessel that they have to go through when they leave the heart, I can clog that blood vessel. So what full phase heartworm treatment is where I do one injection and then 24 hours later, and that injection is imidacide, which is a pretty heavy duty product that kills adult worms. And then 24 hours later, I do a second injection of imidacide. Okay, that's full phase. Split phase is where I'm going to give an injection of imidacide. I'm going to wait a month, let that body recover, let the lungs recover, let the heart recover, and then I'm going to come back in and do the back-to-back. Okay? That's what's called the split phase. And the split phase is the most liked in our vet clinic because the patient is able to manage those worms a lot better. And if they don't do well with that first injection, then we aren't going to do the back-to-back. So this is not in stone. You could start with heartworm preventative, and if you change your mind, come back 2 months later and say, I want to do the heartworm treatment, we can make it happen. The goal here is that we have a live patient at the end of this treatment. So each patient is uniquely different. The size of the dog matters, the age of the dog matters, how long they've been off heartworm matters. Because the longer they're off heartworm, obviously the more babies mature. The older they are and the longer they're off heartworm, obviously more babies have matured. So if it's a young dog and they're barely heartworm positive and they're 1.5 years of age, then we could probably get away with the full phase treatment. But if it's a Chihuahua and I'm trying to kill these worms, I would still do the split phase, or what we call the slow kill, which is heartworm preventative only. Okay? So what does heartworm positive mean? So the heartworm tests that we do, these are antigen antibody tests, okay? Antigen antibody test. And what that means is, if you remember from your high school days, that lock and key mechanism. So if I walk in to the grocery store and I'm exposed to a cold, I'm going to make antibodies against that cold. It doesn't mean I'm going to get the cold, but I'm going to be ready to handle it. Now, if I get sick with something, let's say chicken pox, for example, and I make antibodies towards that, I'm going to be stronger at handling that hit of chicken pox. So the same thing's going to happen with this heartworm test. If I have heartworms, adult heartworms, this test is going to be positive. The only way that antigen antibody test can be positive is if I actually have adult female worms in the body. It's specific to females. Not that that's an issue, because it just tells you, hey, you've got baby making machines in your heart where you're going to keep on keeping on this cycle. That's a problem. So the other type of heartworm test is what's called a difill test. And we use the word difill still, and difill actually uses a membrane and uses a lot more blood. We do a simple direct here. And what that direct is where we take a drop of blood, we look at the slide, and we're looking for the babies. We're looking for the babies. So if I've done a heartworm treatment and I want to make sure I'm killing all those babies, then I'm going to want to do a difill within the next 30 days. Why? Because if I'm still making babies, two things are happening. Either my heartworm preventative is not working, or my adult worms, or I've got adult worms still making babies. So I need to know that I'm breaking that cycle after the adult kill. Okay? So after the adult worms are gone during heartworm treatment, a month later, I will come in and do a difill test. It's a waste of money to do the antigen antibody test because I'm going to be positive for that antigen for at least 6 months post heartworm treatment.